Okay, so good afternoon and welcome to the parallel session on hospital systems improvement and operations efficiency. This is one of the 10 sessions under the hospital operations track of the first National Hospital Week Research Forum. I'd like to acknowledge the participation of the medical center chiefs and other officers of the hospitals that we have today, as well as the different researchers and participants from other institutions. A pleasant afternoon to everyone. Okay, my name is Erickson Feliciano and I am your session chair. For this track with me is Ms. Rovian Pasqua, our session coordinator. The call for abstracts for this research forum resulted in 212 submissions. So these submissions of researchers underwent a stringent screening and selection process. So in this session, we shall account or acquaint ourselves with three that have successfully qualified for presentation. So each of the researcher presenters in this track shall have 15 minutes to present their papers, after which we shall have 10 minutes to answer questions from our audience. The audience is on mute in the entire session. You can actually, but you can post your questions on the chat panel of this virtual session room. You can see the button that will open uh, the chat panel at the bottom of your screen. Maximum of one question only per presenter, but I think we can uh, entertain more questions if we still have time later on as we go along with our session. Okay, so before we close this session, we shall have the synthesis to be provided by yours truly and some onward announcements in the forum program. Okay, so Ms. Rovi flashed here the different presentations for our session 3, part 2 of the hospital operations and efficiency. So first, for our first presentation is from Dr. Eunice Mercado Cabebe from Batangas Medical Center. The title of their research paper is The Impact of COVID-19 Pandemic on the Delivery of Surgical Care at Batangas Medical Center. For our second presenter she's Dr. Yasmin S. Marabe from Vicente Sotto Memorial Medical Center. So the title of the research is The Factors of Delayed Hospital Discharge Among Post-Partum Patients Admitted at Vicente Sotto Memorial Medical Center, a Prospective Evaluation. And last but certainly not the least is Dr. Rufaida S.A. Mahing from Zamboanga City Medical Center with the paper Client Perception on the Primary Healthcare Services of Outpatient Department of Zamboanga City Medical Center. Before we begin with the presentations, allow me to thank you for joining this forum and congratulations for reaching this far into this platform. Let us now start with the first presentation. Over to you, Dr. Eunice.
Good afternoon. I will be presenting my research, the impact of COVID-19 pandemic on the delivery of surgical care at Batangas Medical Center. I am your presenter for today, Dr. Eunice Mercado. Next slide, please. Next slide, please. COVID-19 is caused by a novel pathogen, SARS-CoV-2, and the outbreak spread in many countries, prompting declaration of pandemic by the WHO on March 11, 2020. And according to the WHO, as of December 17, 2020, there are more than 72 million laboratory-confirmed COVID-19 cases, with more than 1 million deaths all over the world. The DOH announced that as of December 17, 2020, there are more than 300,000 laboratory-confirmed COVID-19 cases in the Philippines, and more than 80,000 of which belong to Region 4A, and more than 12,000 of those belong to the Batangas province. COVID-19 made a very large impact on current surgical practices. The current recommendation during the pandemic was to prioritize emergency and urgent cases in the operating room. However, surgical treatment for non-COVID-19 cases still remains necessary during the time of the pandemic. To rationalize hospital functions and resources and to create more space for COVID-19 patients, the DOH issued a department memorandum directing all hospitals under DOH to suspend all private and elective admissions, surgeries, and outpatient services starting March 16, 2020. Next slide, please. Batangas Medical Center is a 500-bed tertiary hospital under DOH, serving as the end referral center for patients in Region 4A. And the Department of Surgery of BAT-MC, with its roster of general and subspecialty consultants in an accredited general surgery training program, also serves as an end referral center for the surgical cases in the geographical region. Since the onset of the pandemic, the department continues to cater to surgical patients regardless of their COVID-19 status. However, government and hospital policy changes led to a decrease of patients being managed by the department. Certain strategies has been made in Batangas Medical Center to cope with the current situation in the Philippines. The major changes include: the first is establishment of risk zones. In the hospital setting, there has been establishment of zones. Designated areas have been divided into these zones according to the risk of COVID-19 exposure. The Philippine College of Surgeons released a recommendation which summarized the indications for the rational and appropriate use of PPE. Similar to the current setup in Batangas Medical Center, the Philippine General Hospital uses the appropriate PPE in relation to the risk level of transmission or zoning. The second is changes in resident duty hours. The department shifted to skeletal workforce in adherence to the Civil Service Commission memorandum, and this response led to less risk of cross-infection and COVID-19 exposure. The third is changes in outpatient services. Outpatient services drastically changed compared to the pre-pandemic era, where patients do not need an appointment prior to consult. Next is maximizing the use of telemedicine. Virtual clinics were started through the use of different platforms, and patients who are assessed to have the need to be seen face to face are prioritized due to the limited slots for physical consultation. Next is transfer to another hospital wing. The hospital administration converted the surgical building into COVID-19 admission ward. The capacity of the department has been reduced from 150 to 32 beds, and surgery admissions have been limited to urgent and emergency cases. Patients who require subspecialist care and management are cases prioritized to be admitted in this institution. Next is designated COVID and non-COVID operating rooms. The OR committee designated 2 operating room buildings into a non-COVID and COVID operating room building. And lastly is the postponement of elective surgeries. Next slide, please. So this is my conceptual framework. Next slide, please. The objective is this study aims to identify the impact on the delivery of surgical care by the Department of Surgery in Batangas Medical Center following the changes in admission and operating room policies. The study will look into and compare the changes before and during the pandemic in terms of services such as number of outpatient consults, ER consults, number of surgeries performed by different subspecialties, and their corresponding patient outcomes. Next slide, please. My study is a descriptive study of all patients seen and managed by the BAT-MC Department of Surgery, conducted from March 1 up to September 30 in the years 2019 and 2020. The data were reported and compared in terms of frequency and percentages. Next, please. Next slide, please. So for the results and discussion, for the summary of demographics of admitted patients during COVID-19 pandemic, in the Department of Surgery, a total of 729 patients were recorded in the admission and discharge registry, and most patients were noted to be in the age group of more than 19 years old, and majority were males. Despite the hospital being a referral center for COVID patients, majority of the patients, or 83.81%, were still non-COVID suspects. In terms of province of origin, 70% of the population came from Batangas, followed by Laguna. So this figure here is the table for the Department of Surgery total admissions. So during the pandemic period, there is an 82.86% decrease for the total surgery admissions. The month of March comprised majority of the admissions, or 41.43%, and had the lowest drop in admission rate compared to 2019 because the lockdown and restrictions only started mid-March and the admissions for patients awaiting surgery were still ongoing. Next slide, please. For the interdepartmental referrals to surgery, there is a 38.33% decrease in the referrals during the pandemic period. The drop in referrals was attributable to the decrease in admissions of other departments and the decrease in hospital bed capacity. For the physical OPD consults, there is an 89.19% decrease in the consults during the pandemic period due to the restrictions of physical consult at the OPD. There was a marked drop in April and May since the OPD was completely closed and the numbers starting increasing again with the revisions in OPD policy and easing in quarantine restrictions. Maximizing the use of telemedicine using virtual platforms prior to scheduling of patients for physical consult was utilized. Despite this, combining the numbers who had physical consultation and those who utilized telemedicine, the total number of patients served in the outpatient setting was still dismal compared to the patients handled pre-pandemic. Next slide, please. For the ER consults, there is a 34.24% decrease in the consults during the pandemic period. One remarkable result are the patients who went home against medical advice and transferred to hospital of choice. There is a 29.28% increase in patients who HAMA and THOC during the pandemic period, and it may be linked to the patients' and relatives' uncertainty of admission due to positive cases admitted inside the hospital as well as limited available hospital beds. Next slide, please. For the total number of surgical procedures done, there was a 76.57% decrease in the number of surgeries during the pandemic period. Next slide, please. This is the data for the operative patients by specialty under the number of surgeries done per specialty. The highest number still came from general surgery, but there was an 84.08% decrease in the number of surgeries during the pandemic period. Under trauma surgery, there was a 28.0% decrease in the number of surgeries during the pandemic period. Compared to the other specialties, the drop in the percentage of trauma surgeries was lower because they were mostly emergency cases, hence they were admitted in the institution despite the limited capacity. All other subspecialties had a decrease in the number of operations during the pandemic period. Next slide, please. For the data on the timing of surgery, there is an 73.10% decrease in the number of emergency surgeries during the pandemic period. The increase in emergency surgeries was not significant because of aggressive measures to optimize conservative management of the patient prior to surgery. If the patient's status was stable and waiting for a negative swab result would not significantly jeopardize the patient's health, the surgeries were not done within 24 hours. This was to balance the risk and benefits of both the patients and healthcare workers if the COVID status of the patient was unknown. This would also be contributory to the rise in the proportion of urgent surgeries. A total of 611 patients were operated as an urgent case during the pandemic period. And the same period during 2019 had 1,690 urgent procedures done. There was a 63.85% decrease in the number of urgent surgeries during the pandemic period. The most notable change during the pandemic was the decrease in the number of elective cases. There was a 90.33% decrease in the number of elective surgeries during the pandemic period. Elective operations were 44% of all operations for 2019 versus 18% for year 2020. Next slide, please. So this is the slide for the top 10 operations for general surgery. Appendectomy was still the most frequent but of smaller percentage in the total operations done in 2020 because uncomplicated appendicitis were being triaged to other non-COVID hospitals. The breakdown of the top 10 operation was also reflective of the decrease in the elective operations and prioritization of emergency and urgent procedures. Next slide, please. For the conclusion, COVID-19 caused changes in every institution, causing different societies to adapt by changing their protocols and practices. The COVID-19 pandemic caused a major downslope in terms of services rendered by the Department of Surgery. The total number of admission decreased by 82.86%. Outpatient department consults decreased by 89.19%, and the total number of surgeries performed decreased by 76.57%. while the proportion of corresponding patient outcomes had no significant change from 2019 versus 2020. Next slide, please. The Department of Surgery experienced significant decline in surgical volumes with a 76.57% reduction. The cancellation of elective surgeries were reasonable during the pandemic due to the associated burden on the hospital in terms of staffing, supplies, and ICU beds and ICU support. Priority was given to emergency surgical procedures as delay in doing these surgeries would pose serious risks to the patient. The department experienced a significant decline in the elective operations with a 90.33% reduction. As the months passed, the resumption of elective surgeries became realistic, as elective procedures consumed less hospital resources as well as an expected fast-flowing overtime of these patients. It is important to emphasize that this significant decrease in the surgical services being rendered in Batangas Medical Center probably translate to increase in the number of patients who do not have access to surgical care during this pandemic. At the same time, it also indirectly shows the magnitude of its effect on the general surgery training program of the department. Next slide, please. For my recommendations and policy implications, the assignment of rooms and personnel to cater to emergency, urgent, and trauma patients must be done due to the continuous influx of patients in the institution. Also, the department can provide new guidelines on which surgical cases should be transferred to other hospitals. Some cases, such as appendicitis and cholecystitis, still need to be part of the census of BAT-MC. That is why prioritization guidelines based on a validated scoring system should be done to know which patients can be catered by the department. The previous practices narrated in the study during the COVID-19 pandemic, as well as epidemiologic data of COVID-19 patients available in Batangas Medical Center, can be used as a basis of healthcare policy practitioners in creating structured guidelines and policies for future pandemic. Despite the ongoing COVID-19 pandemic, it is vital that non-emergency surgeries continue to be addressed. Elective surgery should still be part of the department's essential services while still mitigating the risk of virus transmission to the use of personal protective equipment and proper preventive measures. To adjust to the new normal, changes in hospital protocols must be done. If the resources and manpower permit, prioritization of elective surgeries in non-COVID-19 institutions should be implemented, and triaging of other elective cases through community networks may be done to address the backlog of elective surgeries. Further related researches may include the evaluation of the role of the service delivery network and local government unit hospitals in catering to the surgical patients who were not accommodated in Batangas Medical Center. Since the protocols of Batangas Medical Center are continuously evolving, a follow-up study may also be done to see how the service delivery of the Department of Surgery is affected through the continuing pandemic situation. It will also be beneficial to look into the aspect of how the pandemic has been affecting the training of general surgery residents. That is all. Here are my references, and thank you.
Thank you very Thank you very much, Dr. Eunice of Batangas Medical Center, for sharing with us the impact of COVID-19 pandemic to the delivery of your services, particularly surgical care for your patients. Okay, so let us now proceed with our second presenter for this afternoon. She is Dr. Yasmin S. Marave from Vicente Sotto Memorial Medical Center to discuss her research entitled Factors of Delayed Hospital Discharge Among Post-Partum Patients Admitted at Vicente Sotto Memorial Medical Center. This is a prospective evaluation done in their hospital. The floor is yours now, Dr. Yasmin.
Good afternoon. My study is about factors of delayed hospital discharge among postpartum patients admitted at Vicente Sotto Memorial Medical Center, a prospective evaluation. I am Dr. Yasmin Marave, a medical officer for Vicente Sotto Memorial Medical Center. To date, there has not been much studies looking into specific factors possibly influencing delayed discharge, be it local or internationally published. This important aspect of patient care and administrative concern has seemingly been neglected in terms of the weight of attention it should have been receiving, given the fact that it is an actual dilemma that we, as clinicians, encounter in the day-to-day setting, especially for those practicing in the government institutions. Delayed transfer from hospital is a long-standing concern of organizations and professions within the health and social services in the world. It refers to the situation in which a patient, although deemed medically fit for discharge, continues to occupy a hospital bed because of delays in the continuing care. In the study setting alone, delayed discharge is a common scenario, which can contribute to a limited access for decent and appropriate patient accommodation. Given the already limited number of patients' bed, overcrowding for a generally well patient along with their newborns could also be an increased risk for hospital-acquired infections throughout their prolonged length of stay. Hence, this study, which seeks to commence efforts geared towards administrative changes in the improvement of the Department of OB and the entire hospital system. The objective of the study is to determine the factors which cause delayed discharge among postpartum patients admitted at Vicente Sotto Memorial Medical Center. Specific objectives include to determine the proportion of patients with delayed discharge among obstetric patients admitted at Vicente Sotto Memorial Medical Center. Second is to determine the proportion of patients with delayed discharge among obstetric patients admitted at Vicente Sotto Memorial Medical Center, stratified according to OB normal and OB abnormal. Third is to determine the sociodemographic of respondents with delayed discharge at the Department of Obstetrics and Gynecology of Vicente Sotto Memorial Medical Center according to age, educational attainment, socioeconomic status, employment status, marital status, and number of children. Fourth is to determine the proportion of patients with delayed discharge among obstetric patients admitted at Vicente Sotto Memorial Medical Center, stratified according to unsettled account, undischarged babies, need for blood transfusion, comorbidities or complications, healthcare professionals' delay, and absence of significant others. Fifth is to compare the final disposition of patients discharged on time and delayed according to the following: absconded, died, home against medical advice, and improved. For the methodology, this research employed a prospective descriptive research design. This study was conducted at the high-risk and low-risk wards of the Department of Obstetrics and Gynecology in Vicente Sotto Memorial Medical Center from August to October 2016. The study population was composed of mothers admitted under the care of the section of obstetrics of the said tertiary medical center. In getting the sample size for data gathering procedure, the researcher employed quota sampling technique and used Sloven's formula in getting the desired sample study. A draft of the research instrument for data gathering, as well as a sample protocol, were given to research committee for evaluation and analysis. A checklist in the questionnaire was placed to aid in data gathering. The researcher personally administered the questionnaire. In the event that delayed discharge was found in a particular patient, the researcher identified the possible reasons for such delays. All data gathered were encoded in Excel program and were analyzed. So among the admitted obstetric patients in Vicente Sotto Memorial Medical Center, 96% have delayed discharge. From a financial standpoint, delayed discharge can increase the cost of hospitalization, and the hospital would also be losing revenue since majority of the patients are indigent and are being subsidized by the hospital. From a health standpoint, delayed discharge leads to overcrowding in the ward, which increases the risk of developing comorbidities such as nosocomial infections. Among all cases of delayed discharge, patients who were classified as OB abnormal constitute more than half of the total of number of cases. This can easily be explained by the fact that this institution, being a tertiary medical center, receives referrals from other healthcare facilities, most of which are high risk. Majority of the subjects belong to the 18 to 29-year-old age group and majority of the subjects who experienced delayed discharge were those who had secondary education, who were employed, and majority also were earning a minimum wage. Low educational attainment may contribute to the delay in the discharge of patients due to possibility that lack of sufficient education may make it difficult for patients to find a job or career that offers a higher income that can cover and sustain their healthcare needs. Majority of the subjects in the study who experienced delayed discharge were single and majority also had one child. Majority of the subjects experienced delayed discharge due to undischarged babies. Possible reasons for this includes baby's medical condition and delayed processing of the certificate of live birth. Finally, majority of patients with delayed discharge were discharge improved. In conclusion, 95% of OB patients admitted had delayed discharge, and majority belonged to OB abnormal. Among those with delayed discharge, majority belonged to age group 18 to 29 years old with secondary level of education, earning minimum wage, single, unemployed, and with one child. The factor that caused most of the delay in the discharge of patients was undischarged babies. Majority of patients with delay in discharge were discharged improved. For the recommendations, there should be an area in the hospital where mothers with undischarged babies can stay. There should be coordination between hospital staff to facilitate discharge of patients. There should be coordination with the Department of Pediatrics so that discharge of babies may be facilitated. There has to be an increase in manpower to ensure that the hospital is ready to accommodate large influx of patients. The hospital should conduct a monthly bloodletting program to ensure there is enough supply of blood. Strict implementation of turnaround time protocols for the admission and discharge of OB normal patients to minimize crowding. Thank you and good afternoon.
Thank you very much, Dr. Yasmin Marabe of Vicente Sotto Memorial Medical Center. So a very timely research paper and a very interesting one, identifying the factors causing the delayed discharge or hospital discharge of postpartum patients. So later on, Dr. Marabe will be able to address your questions if ever you have one. Okay, so for our third and final presenter this afternoon, may I call on Dr. Rufaida A. Mahing from Zamboanga City Medical Center to present to us the client perception on the primary healthcare services of the outpatient department of the Zamboanga City Medical Center.
My research entitled Client Perception on the Primary Healthcare Services of Outpatient Department of Zamboanga City Medical Center. I am Dr. Rufaida Mahing, a Medical Officer 4 from Zamboanga City Medical Center. The Alma Ata Declaration of 1978 emerged as a major milestone of the 20th century in the field of public health, and it identified primary health care as the key to the attainment of the goal of health for all. Primary health care is considered as the first contact between the patient and the healthcare system. It includes all the basic healthcare services to every member of the society supported by integrated referral systems. However, despite of the existence of referral systems, there had been a pronounced shift in utilization from primary public health facilities to government hospitals. Thus, government hospitals end up providing the same services as primary health care facilities. Zamboanga City Medical Center, or the ZCMC, has a similar setting, especially the outpatient department, partly because it is the only existing government-run Level 3 medical center in Zamboanga Peninsula. In addition, the accessibility of ZCMC to the catchment areas in terms of distance, time travel, and availability of public transportation contributes to the increased demand for its services. This study can serve as a basis to identify the areas that needed improvement in the OPD. It can serve as a basis for continual improvement of the health system delivery in terms of strengthening the primary care services. Furthermore, incorporating patient opinions into quality assessment can open ideas of making health services more favorable to people's needs. This study aimed to determine the client perception on the primary health care services of the outpatient department of Zamboanga City Medical Center, specifically to determine the client perception on the personnel, to determine the client perception on the services, and to determine the client perception on the facility of the outpatient department of ZCMC. This study employed a cross-sectional study research design. Purposive sampling was used for the first phase, and convenience sampling was used for the second phase. The respondents of the study were patients consulting at the 4 outpatient department of ZCMC. There were 28 respondents from OB-GYN, 72 from surgery, 148 from pediatrics, and 152 from family medicine, with a total of 400 population. FGD guide questions was used for the first phase, and assisted questionnaire was used for the second phase of the study. Data gathering procedure has 2 phases. On the first phase, formulation of the FGD guide questions was based on the previous studies, results from the preliminary interview, together with the customer service satisfaction questionnaire. Orientation and brainstorming of the FGD facilitators was conducted prior to the session. There were 3 facilitators who supervised the 3 groups, Chabacano, Bisaya, and the Tausug group. Recruitment of the FGD participants. The group was based on the dialect spoken by the respondents. Each group was composed of 10 participants who were selected according to their educational attainment, with 2 participants in each level, 1 female and 1 male. Conduct of the FGD sessions. There was only 1 session for each group that lasted for 2 to 3 hours. All discussions have been recorded. On the second phase, formulation of questionnaire. Results from the FGD sessions that has been transcribed and tabulated per team. After which, the assisted questionnaire was finalized. Lastly, administering of questionnaire was conducted by the research assistant. The data was presented using the descriptive statistics. Demographic profile of the respondents were presented using frequencies and percentage. Results from this questionnaire has been categorized per team, per areas, or component of primary health care services. For the demographic profile of the respondents, the mean age of the respondents was 32. Majority of the respondents are from family medicine and pediatrics departments. Most of the interviewees were predominantly female. In a previous study, females were also the majority of the subjects because females are more concerned about their health than males. Majority were married. Roman Catholic is the most practiced religion, followed by Islam and Protestant. Lastly, most of the respondents reach high school level. Table 2 shows that majority of the respondents perceived that the personnel were knowledgeable and well-mannered. However, as to whether the doctors explained the disease or performed thorough examination, more than half preferred not to answer the item. The possible reason for this because of the bulk of the patient in ZCMC that doctors perform only a focused physical examination during the consultation. For services, majority claim that laboratories are accessible. Consultation fee is affordable, and the service delivery is fast. However, other fees such as laboratory, X-ray, and medicines, as well as accessibility of supplies, majority preferred not to answer. Mainly because a consultation fee of 20 pesos gives its affordability, while for the laboratory, X-ray, and medicines, the amount will vary depending on the services offered. For a facility, majority claim that OPD is accessible and the environment was clean. Also, half of the respondents claimed that chairs are enough, while the other half claimed otherwise. Majority did not answer if wheelchairs is enough because not all OPD patients need wheelchair. In conclusion, majority perceived that the personnel are knowledgeable and well-mannered. As to services, clients claim that laboratory is accessible, consultation fee is affordable, and service delivery is fast. However, medical supplies are not accessible. Other fees like laboratory, X-ray, and medicines are not affordable. As to facility, clients claim that the OPD is accessible and clean. However, chairs and wheelchairs are not enough. One of the challenges for health services in developing countries is to search and develop ways to make them more patient-oriented. Assessing patient perspectives open new ideas to make the services more responsive to the needs and expectations of the community to make the health systems more effective. However, this study has certain limitations. The questionnaire used in the study may limit the patient's chance to further express their concerns about the quality of personnel, services, and the facility. The current setup of the OPD and the time of the study was conducted. This study recommends to strengthen patient-physician relationship, especially in communication skills, strengthen awareness on the social services in the hospital, a concept on one-stop shop for medical supplies, and provide additional numbers of chairs and wheelchairs in the OPD. And another similar study should be conducted to explore on the services offered by the ZCMC.
Thank you very much, Dr. Rufaida, for that clear presentation. Okay, so, and again, thank you to all the presenters. So let us now hear the questions from our audience. And may I request all the presenters, our three esteemed speakers, to please turn on your videos. And may we request the participants to type in your questions in our chat box. Kindly indicate the name of the presenter to whom you are addressing the question, followed by your question. Okay, so yan. Thank you. Thank you for turning on your videos. Okay, so may I address a question to Dr. Eunice? Good afternoon, Dr. Eunice. So your analysis on the impact of the pandemic to the delivery of surgical care is reflective of some other regular services as well that may have been affected because of the current pandemic or situation. And this research is very timely for everyone, and especially for those in the hospitals. For non-elective surgeries, Dr. Eunice, was there by any chance an analysis as to where the patients availed this essential surgical care? Because as you mentioned, there was a significant decrease in your surgeries that you have conducted. So where do you think these patients actually obtained the services?
Actually, that would be a good research, another research after this research. So I think most of the patients probably had their surgeries at a private institution or maybe a district hospital. So we don't know yet where they had their operations done.
Thank you. Thank you very much, Dr. Eunice. And we really think that there were different factors why the patients there was sudden drop or significant drop in terms of the number of surgical care provided by the institution. Thank you for responding to that. And as mentioned, another research paper can be conducted out of that question. So thank you, Dr. Eunice. Okay, so for Dr. Marabe, Dr. Yasmin, uh, what do you think are the common factors or causes for delayed discharge of babies? Because as you mentioned, this is the number one factor for the delayed postpartum discharge. Was there any significant or uh, pattern or reasons why or causing the delayed discharge of the babies that leads to delayed discharge of the postpartum women?
Yes, good afternoon. We were able to identify two factors. First is the comorbidities of the baby. There was a delay in discharge because the baby needs antibiotics or further workup because the baby developed infection. And the second is the birth certificates of the baby because most of our patients are single. So they need the recognition of the father if the mother wants the baby to take the father's last name. So they have to get an affidavit for that, which takes time also. So that's the two main reasons for the delayed discharge of the babies.
Actually, that was a very interesting answer, Dr. Marabe. The first is the morbidities or comorbidities of the babies, but really the birth certificates and these requirements really contribute to the delayed discharge. And if that could be addressed, then probably we'll be able to improve turnaround time and also the quality of care to our patients. Thank you. Thank you for responding to that question. And we have one
Thank you.
for Dr. Rufaida Mahing. Hello, Dr. Rufaida.
Hi, good afternoon po, sir.
Okay, so you mentioned, Dr. that FGD or the focus group discussion was one of the methodologies that you employed in this study. Can you tell us more on the FGD in terms of the perceptions of the participants mentioned, be it negative or both negative and positive perceptions?
Yes. Thank you po, sir, for the question. Um, the results of the FGD during that time was more of the majority. The respondents claim more of positive um, attitude of the personnel, especially on the knowledge and well-mannered. Majority naman po answered that the personnel were well-mannered. However, as to the yun na nga po yung majority did not answer as to if the personnel, especially the doctors, do physical examination or explain the procedure, explain whatever the procedure, or explain whatever the examination that will be performed prior to the examination.
Thank you. Thank you very much, Dr. Rufaida. And it's really very important for us to utilize this methodology such as the FGD because we can really get information and good research data through this methodology. So thank you again to our
Thank you.
presenters and thank you for answering our questions very well. So that's all the time that we have for the Q&A and your questions. If you have additional questions posted in the chat box, then they may not be addressed, but rest assured that these shall be included in the documentation of this activity. Okay, so allow me to give a synthesis or a few words for this session. Hospital systems, improvement and operations efficiency are goals that ultimately lead to excellence in provision of quality care to our patients. We have listened to the three very good research presenters that tackled on how the operations of different hospital sections can be improved. So for Dr. Eunice Mercado Cabebe, she discussed the impact of COVID-19 pandemic on the delivery of surgical care at BMCR Batangas Medical Center. And according to her study, the current pandemic caused a significant drop in terms of the services rendered by the hospital's Department of Surgery. The study provided us with recommendations on how to maximize hospital services and to continue the provision of quality care despite the current challenges that we have. The second research paper presented by Dr. Yasmin Marabe of Vicente Sotto Memorial Medical Center investigated on the factors that contribute to the delay of hospital discharge among postpartum women. This prospective evaluation identified that majority of obstetric patients experience delayed discharge, and the factor that mostly cause such is related to undischarged babies. So among the many policy implications that she mentioned, I'd like to make or to mention the provision of area for mothers with undischarged babies and the coordination to facilitate patient discharge and strategies to minimize overcrowding, uh, which are important or very good to be noted. And lastly, the client perception on the primary healthcare services of the outpatient department of Zamboanga City Medical Center was presented by Dr. Rufaida Mahin. The client's perceptions in terms of the OPD personnel, services, and facilities are generally positive. So the research have made mention of additional recommendations on how we can improve services such as the strengthened patient-doctor relationship and the concept of one-stop shop for accessibility. Thank you very much once again, and a round of applause to all of our presenters this afternoon. Okay, so I think that's all that we have for this parallel session on hospital systems improvement and operations efficiency of the first National Hospital Week Research Forum. Okay, so as some of you are aware, there are 30 papers out of the 60 presented in this forum that are in the running for the best research paper. So the winners will be announced and awarded at the closing plenary session of the forum. So that's for tomorrow. We also expect all of you to join us then. Okay, so before the first National Hospital Week Research Forum formally closes, the link to the post-activity evaluation will be announced and posted. And all of those who will be able to fill up the online post-activity eval form shall receive certificate of attendance in return. Okay, so again, thank you very much. This parallel session has concluded. The Health Facility Development Bureau would like to thank all of you for your participation and see you all tomorrow at the closing and awarding ceremony.